Can cheek fillers cause headaches? Well, never heard of such a thing before. But long story short, headaches are not a documented consequence of cheek fillers. But then there have been instances of individuals, you might have, your friends or family, someone in your friends or family complaining that they've had a headache after post filler treatment. So in this video, I'm going to be sharing my insights as to what are the probable reasons one gets a headache after filler, who all are susceptible, and stay till the end because I will be sharing some tips to, help you alleviate and prevent those symptoms. And before we go further, do show some love by hitting the subscribe button and ringing the bell icon. Hello, everyone. I'm Dr. Bhavna Agarwal, facial aesthetic consultant, beauty psychologist, and aesthetic physician. And this is a series of videos which I'm doing question of the day. All the questions I'm currently taking are pertaining to the cheek fillers, and this is the question which came to my notice, and I thought this is something that needs to be addressed. So this was about that my friend has had a cheek filler and she had a headache for 2 days after the filler. So is it something which I should also expect? So this video is a response to this question. So one of the probable causes, if you've had experienced a headache after a filler, is inflammation from the injection process. So, after getting cheek fillers, there's a lot of inflammation because we're introducing a foreign substance into the body. And the body responds by swelling, redness, irritation, and the tissue disruption and all. So this will trigger a lot of release of histamines, and it will dilate the blood vessels, etc. And also the fillers, mostly they are hyaluronic acid based fillers, which will also attract water to the injection sites, which will add to the swelling caused by the inflammation. And this combination of all the, factors right by your cheeks near the temples could be the reason which can lead to uh, headaches. Now, second is muscle tension and bruising. Now, when you're injecting a gel substance, there is some internal stretching of the facial skin, connective tissue, the muscles, and all, the ligaments. And this sudden muscle tension, along with the, needle trauma and all, can cause, tension headaches. And basically, these will be like dull type of headaches, feeling like a tight band around the forehead or scalp. So usually the incidence, what I see is like 2 in 10 individuals would complain of such a thing. It is not something very commonly seen. And this is the most important factor, the stress and anxiety. Many people I've seen are very stressed about their procedure, especially someone who is getting their injectables for the first time. They are very stressed and anxious, not only about the procedure, but what will happen after the procedure, that is also always bothering them during the procedure. So this will release to, this will lead to surges in the stress hormones. This will also increase some muscle tension. So this is the most common reason, I would say, which is responsible for post-filler headache. So what types of headaches are common? So again, to summarize, there could be tension headaches. It could be migraines. So if you have a history of migraine, the migraine could get triggered. So that could be one reason. And then it could be cluster headaches. So any of these kinds could get triggered. And each of these has its own kind of symptoms, but mostly the symptoms are mild, usually resolve within 3 days, and rest and your regular medication is something that you will need at the most. And how long will these last? As I said, maybe just for 2 to 3 days. If it lasts longer, then obviously you need to, talk to your doctor. And so it might be severe in one for first or second day, but gradually it, settles with time. Now, how to treat these headaches after cheek filler injection? What you can do is that you can do certain cold compresses. You can take your regular pain medication. You can do, pressure massage with your fingertips on the forehead. Stay hydrated, relax, take rest, and limit your activity. And avoid the, some facial steam showers. Avoid taking alcohol, etc. Avoid rubbing and massaging, and you can also avoid your gymming or physical activity after you've taken a filler for at least 1 or 2 days. Now, when to see a doctor? if the headache is not resolving even after 2 to 3 days, and severe headache is persisting after 72 hours, then it could be an alarming sign. It is very rare. I am not here to scare anyone, but this is very rare. But if at all it happens, this is the protocol that needs to be followed. Now, what you can do about it? So first is plan your procedure on an easy day, especially for the first time injectors, or for the individuals who are getting the injectables for the first time. Plan it on an easy day, and also probably when you have an easy day the next day also. So that is something important that will help. And be well hydrated and well fed before the filler procedure and after the filler procedure. This works like magic. If you are empty stomach, you react differently, and when your stomach is full, you react and behave differently. And most important, keep relaxing. That is the key. So, and if you have any apprehensions, you can discuss it before the procedure, but during the procedure you should be going into the procedure with complete clarity and relaxation. So I hope my video has helped and I have been able to answer the question. And thank you for watching. Keep sending in your questions, and see you in the next video.